engage with their community. We've sat with traditional leaders all across northern Nigeria to get their input into how they engage with their communities towards strengthening primary health care, especially routine immunization. We've seen historically that because the traditional leaders were involved in polio eradication, we've gone 25 months now without a single case of white polio virus that has been reported. It is exactly the same pathway we're taking with routine immunization. You recall that a few years ago in 2016, we had very poor routine immunization coverage. Now, working with the traditional institution, again, we're beginning to see an increase in routine immunization coverage. What we're doing here today is to symbolize how that engagement happens, how the traditional institution is involved in enlisting children once they are born, ensuring that they go to the health facility for the vaccines, and then when there's an outreach in their communities, ensuring that all eligible children are provided with the vaccines. And if, peradventure, either by omission or commission, any child misses their vaccinations, the traditional institution, our traditional leaders, will actually help track those families and ensure that those vaccines are given free of charge. So for us, we're really excited about what this really represents. So at the end of today, there will be manuals that all levels of traditional institutions will actually take home that describes their roles and responsibilities in a way that is easy to understand, in a way that they can also take back to their communities and really cascade down in terms of training the lower level traditional leaders.
Okay, for sustainability purposes, what are the strategies that have been put in place going forward?
Sustainability, there's nothing as sustainable as the traditional institution, right? The traditional institution that we're involved in ensures that long after one administration leaves, right? The traditional institution is there, the traditional leaders are there, and this is why we have brought the community engagement framework so that they will drive it. They've always driven it. The only thing that we're doing is making sure that it is systematic all across northern Nigeria, but also learning from their experiences, discussing with the traditional leaders from southern Nigeria who replicate this. Again, most of the routine immunization coverage burden has been in northern Nigeria. This is why we're starting from northern Nigeria. But we're also beginning to engage with the traditional leaders from southern Nigeria to see how we can better improve on their community engagement. For example, we've started with Bayelsa, where we have meetings with the Council of Traditional Leaders, and because of their intervention, we're beginning to see increases in routine immunization coverage, utilization of primary healthcare facilities in Bayelsa State.
So why is immunization coverage low in the northern part of the country?
Well, there are multiple factors, right? There are issues around lack of awareness. A few years ago, you know, there was this issue around oral polio vaccine safety. Again, working with the traditional institution, we've been able to overcome, for the most part, those resistance, non-compliance to oral polio vaccine. We are sure that in the course of the next few months, using the traditional institution again, people are going to be less hesitant. People will now accept more of the vaccines. But the other issue is also around funding. A number of states do not provide dedicated funding for routine immunization and primary health care. Even when it is in their budget, they do not release the funds. But we've been engaging with governors, we've engaged with the Nigeria Governors Forum, we're engaging with all stakeholders, and it is very clear that moving forward, a lot of states now understand that we cannot compromise on the health of our children, and they are beginning to release more funds because there's now more transparency in the way these funds are utilized. Part of the problem has been, that concern that even if these funds are released, they may not be used in a way that is judicious. But we're beginning to see greater confidence in the system. So we hope that in the course of the next few months, in the course of the next few years, that there will be more funding available for not only routine immunization, which will bump up the coverage, but also primary health care as a whole. In terms of funding, this is one of the reasons why the federal government is rolling out basic healthcare provision fund in the next few weeks, we are hopeful that President Muhammadu Buhari will launch the Basic Healthcare Provision Fund, wherein there will be an opportunity for mothers, guardians to take their kids to health facilities, right, and not be worried about out-of-pocket expenditure, right? The vulnerable groups in our communities, the children under 5, the aged, women who are pregnant, women who are delivering, will now not pay for basic services in the health facilities. So this is another exciting thing that is happening in the healthcare space. So I'll ask you to really stay tuned for when this launch takes place, and then you begin to see how basic primary healthcare will be delivered to all Nigerians with compassion, dignity, and respect for all community members.
Thank you very much. Thank you. You can take the email speak with our leader.
Reporters, move back, open up for camera, please. Make them move back, move back.
Any questions? I wouldn't want to call it a revolution, but I definitely see improvement in coverage. The number of children.
This man should move back now. See, your back is in my shot.
Everywhere in northern Nigeria.
The north seems to be this guy backing back. Calm down now.
Issues with respect to primary health in the north over the past year that needs to be corrected.
Edie mentioned that by number. Leading amongst which is the issue of access. A lot of our communities don't have access to private healthcare facilities, either because of distance or because routinely needed medicaments have been available in the village. Secondly, there is an issue of distrust, and of course the availability of traditional means of providing care and cure to elders, especially in the villages. So these are some of the factors that inhibit parents from taking their children.
How the contribution of tradition itself, how contribution of traditional rulers change this better?
Through enlightenment, sensitization, and of course role modeling with our own children, taking them to see the future first, volunteering, vaccinate them ourselves. This improves confidence in the system. Generally motivated.
Okay, very quickly, sir. As a woman, I don't want to be partial, but do you have direct contact with women in this fight?
Yes, we have what we call TDAs, the traditional birth attendants. Normally after the day, we deal directly with the mothers. But you must understand the situation in tradition about the husband is the head of the family and he makes decisions. So what we do is we talk to the husbands first because we know they take decisions, whether the wife, daughter, or son is allowed to take it for the rest of the husband. So our first goal is actually try to change attitude with regards to vaccination and access to primary health services.
So what was the role of the NPHCDAs in the development of these people?
We mobilize our colleagues to represent the entire traditional system in Nigeria at these meetings. And whatever we discuss, we take back. We are like the entire whatever decided
Lady, to see.
together with our partners, councils and chiefs.